promotion by WHO, and we are providing the discussion with this as framework. And we are going to be focusing on the actions that we can take to keep our communities, our societies, and our planet healthy. And from that, we will, of course, have some questions that go above and beyond health, the health sector, if we want to have a truly effective response. It's not just up to the health sector to be active in the area of our planet. So the question is, how can we involve other sectors and how can we involve not only the different levels of government, that is national, subnational, and local levels, but also the community. And how can we make sure that the topic of health can really become a key aspect of other stakeholders' agenda? So this is some of the topics that we will be discussing today with our experts. And it is very important for us to talk about health promotion as a framework of discussion, because that is where intersectoral uh, actions and engagement and governance at the different levels of government, specifically the local level and the social determinants that we're going to be discussing today's topic. So basically, the most important thing now are our speakers, our guest speakers who will be talking about this. So without further ado, I would like to introduce all six panelists. We have Dr. Daniel Bus, who is the advisor on public uh, public climate change, I'm sorry. Welcome, Daniel. We also have Dr. Adolfo Lopez, the director of the Partnership for Public Health in the Americas and an active member of the Dominican Republic Public Health Institute, Felipe Gonzalez, head of the Mexican Association for Public Health, Dr. Carlos Galvez, chair of the Panamanian Public Health Association, Catherine Catalano, Deputy Director for the Center for Climate and Equity in Health from the U.S. Public Health Association, and also Dr. Arturo Quispe, who is the Director of LIAC Latin America. As I said before, this is a joint effort between public health associations in the Americas, APHA, the American Public Health Association, and PAHO. So I would like to begin with this initial question to everyone. So basically, in about 3 minutes, could you give us an idea of how, from your point of view or from your space, you work towards better health for the population and for the planet? So we will begin in the same order as I mentioned you at the beginning with Daniel. So 3 minutes. Go ahead, please.
Gracias, Jerry. Muchísimas gracias
Thank you, Jerry. And
por
thank
la
you so
invitación
much for
a esta
joining us today.
organización, este
Thank you for the
panel.
invitation to be part of
No,
this
gracias por la
distinguished
pregunta
panel.
también con la
And thank you
siguiente,
for this question
hablar un
also,
poco
because
sobre
it enables us
cómo
to
vemos desde la OPS
talk about
también,
how we
no
can
solo
see
los
from PAHO
impactos, cómo generan los impactos
not
sobre la salud
only
en términos
the
de
impact on
la
health, but
situación
also the
actualmente
solutions. I
recientemente
believe
se
this is a
vive.
very
Y
interesting panel.
trazando un paralelo, ¿no? Para
And now,
empezar
if we make a
con
parallel
esta terrible pandemia de COVID-19 que nos
to this
mostró
terrible
una vez
COVID-19
más
pandemic,
esta
which once
interdependencia
again
con el ambiente
showed
y con
the
nuestro planeta.
interdependence with
Y creo que
the
lo que queda
environment and our
visible
planet,
los componentes
I
del
believe that
ecosistema hoy, la
the
triple
components for
crisis
what we saw,
planetaria,
the
¿no? De cambio
triple
climático,
planet crisis,
extinción
that is
y
to say,
pérdida de
climate
biodiversidad,
change,
y se
pollution,
encontraron
and loss of
fuertemente en salud también.
biodiversity, we
Y
could
para
also
mí era
add
muy
health.
similar a la pandemia,
And the
con una
origin is very similar to that of the pandemic, although it
pero tiene orígenes
came about through
humanitarios
different
muy
ways. But
influenciados por la manera
it
como
starts in
nuestra
the
sociedad
environment, and they are
produce,
influenced
consumen
by the way
servicios
in which the
y
societies
influenciados en parte
live,
por la rápida,
consume,
por el rápido
And also because of the rapid transportation to move around goods and services all around the globe. But similarly, the pandemic has shown us that as a result of the weaknesses that we have, for example, in infrastructure and public health services, the lack of uh, capability of identifying impact early on or interrupting infections or the impact on health with other complex routes. In the case of climate change, for example, we can see an impact on health through heat waves, an increase in extreme weather events such as floods, wildfires, etc., but also indirect through a loss of harvest, forced displacement, impact on mental health, etc. Mainly in both cases, or the several cases that I mentioned, every single time, the most impacted ones are always the same: the poorest of the poor, the marginalized, the voiceless, and those who do not have a seat at the table. This is key, and we must always reiterate that and be more effective in including these voices and these points of view and perspective for decision making purposes because they are the most vulnerable people. And as PAHO and as United Nations, or as a person that live or people that live on this planet, we need to fight for the rights of those who do not have rights. I believe that this is key, and these type of discussions enables us to weigh in how important it is to focus on the ethical aspect with these people that need us the most. And in order to move forward, we need to build bridges with other sectors, with civil society, because we're all part of the problem. So we should also all be part of the solution. This is an item that I would like to continue discussing with you today. That is to say, in what ways PAHO works on this with the different member countries and civil society. And again, it's a pleasure to be here today. And thank you so much for the invitation. Thank you, Daniel, for your point of view from PAHO and in the and also to bring a focus on inequity and the solution that is all up to all of us to implement. So now I would like to ask Dr. Arnulfo Lopez to also refer to the same question. So go ahead, please.
Prende tu micrófono, Arnulfo.
Arnulfo, you're muted.
Oh, sí, me disculpas.
Oh, my
Sí, gracias.
apologies. Yes.
Gracias, Jerry, gracias,
Thank
doctor
you,
González.
Jerry, and
Sí,
thank you,
y
Dr.
gracias a la
Rosales.
OPS
And
nuevamente
thank
por
you, PAHO,
permitirnos a
once again,
nosotros la
for
oportunidad de
giving us
compartir
the
con nuestros
opportunity
distinguidos colegas
to
de
share this
esta,
panel with such
esta,
distinguished
hablamos del tema
colleagues.
nuestro planeta,
We're
nuestra
talking
salud,
about our
que es un
planet,
tema
our health,
mundial y que
which
obviamente
is,
comenzamos
a
el día con una
global
reflexión.
issue, and we must reflect on this
Y es
collectively.
precisamente bueno recordar los efectos
And it is
nocivos que
good to
sobre
talk
todo
about
afectan
the
directamente a lo
harmful
que tiene que ver con esta
impact
problemática, ¿no? Pero lo más importante
stemming
es
from
que lo
mostly
que
climate
tenemos es la
change. But the
necesidad
most
que
important
tenemos
thing
de
that we see is
concientizar
the
a la
need we
población
have to make the
sobre nuestro
population
futuro,
aware
nuestros
of the
comportamientos,
how
todo lo que tiene que ver
damaging some of our
a
behavior
todo lo que tiene que ver con
is
nosotros, ¿no? Y sobre
on the
cómo
environment.
podemos ayudar a mitigar
And
o a
we can
minimizar
all
los
be
dolores que
part
nos
of
provoca
mitigating
los
some of
diferentes
these
escenarios
impacts
climáticos.
from our
Se ha
own
quedado
position in life.
bastante claro los efectos
It's been
del
pretty clear
calentamiento
that
global en
global
el siglo pasado
warming is
y
an issue
ha
and has
tomado
become worse
claramente
over
con
the
nosotros
past
los seres
century. And
humanos
this is a
como
direct result of
una
human
amenaza
activity
que
through
requiere el
the
calor,
emission of
usualmente llamado efecto invernadero, ¿no?
GHG or
Y eso
greenhouse
estamos utilizándolo
gases.
para
And
cubrir nuestras necesidades energéticas
we do that because we need to, cover our
además
own
de eso es
needs in modern
en esto
life.
de
But
pandemia,
during the
si
pandemic,
hablamos de los beneficios
if
de
we
la
talk
protección
about
del
quote
carbono,
unquote the benefits of this
ha habido
COVID pandemic,
una reducción
there
del
was a
efecto
significant
invernadero,
reduction in
inclusive una
greenhouse
disminución
gases and
en
even a
el
reduction
tráfico ilegal de la fauna
in
salvaje.
the illegal
Entonces,
trafficking
este
in
tipo de medidas
wildlife.
que están
So
denominados
we
incidir
can see that we
en
can
esta área.
have
Pero
that we do have
por
an
eso entonces
active
hablamos más que
role
los
on
beneficios,
this.
necesitamos
So
educación.
what do we need? We need
Necesitamos educación desde
education.
el inicio.
from the very beginning.
para nosotros hablar de
That is to
promoción
say,
de
in
la
order
salud
for us to
humana,
talk about health promotion or
primero tenemos
access,
que
we
comenzar
need to
desde
first
la educación
begin
en
by
la primera infancia,
educating
en nuestros hogares,
early
para que
childhood,
esto sea la
from the early
base
childhood and at home,
de una vida
so that
saludable
we can
y de una
ensure that we
vida
have
plena.
a healthy
Pero
and active life.
digamos nuevamente, el enfoque tiene que ver
But
directamente
once
con
again,
garantizar
the
una
focus has to do with
esa deuda social
ensuring
que
equity, that
tenemos,
quote unquote
esa
social
sociedad
debt
que
we
tiene que
have
ser
towards equity,
tratada, manejada y
equity that is
progresada en
talked
todos los
about
discursos, en
so
todos los
widely
discursos
in
académicos.
every
Sin embargo, cuando
paper or in
tiene
every
que
speech.
llevar
However, when it comes
ejecutar
time to
el presupuesto
actually
de nuestro
do
gobierno,
something
están ausentes.
and have an
Entonces,
actual
ese es
budget
el
for it,
punto
it's just
importante
not
de este
there.
punto, ¿no?
So we need to
Estamos
focus on
casi
that as
garantizados
well.
a
We
través
had to ensure that we
de
can
las
do
políticas
something
de salud
by
para
having
tener una
enough
responsabilidad
a budget line as
bancaria
part of our
de
health
los
policies.
gobiernos, ¿no?
And this is something that we need to
Hablamos
call on our governments to do. That is to say,
una
we talk
cobertura
about this
universal
of
y
this
sostenible para el sistema de
universal
salud. Pero
um,
nosotros vimos
healthcare
ahora mismo en esta pandemia
coverage, but we saw during the
cómo
pandemic
salió a flote la realidad de nuestros
how
sistemas de salud.
we
¿No?
saw
Y
the
yo creo que
reality,
también
the
ese,
true
esa
reality of
deuda
our healthcare
pendiente que
systems.
tenemos,
And this is
este es
like
el
a
momento que debemos
unfinished
aprovechar
business. And since it's
porque
unfinished business,
precisamente
we need to take advantage of
el que haya
this
florecido todas
time.
estas actividades
The fact
para
that
ver
all
cómo
these
nosotros entonces podemos
witnesses came to
hacer
light
una reingeniería
so that we can see how we can
al sistema de salud
re-engineer
es
our
porque nosotros
processes, our
hablamos de que no había
infrastructure,
cura,
our
pero
decisions.
siempre
Why?
se
Because
tomó
we always
la
said
recomendación
that
de que
there
un diez por
was
ciento
no,
del
there
Producto
were no
Interno
funds,
Bruto
and to have
dedicado a salud.
10% of
Y por
GDP
lo menos un
allocated
seis
to
por ciento iba
health, or
para
at
los
least
tratamientos que tenían
6%.
que
But what
realizarse.
happens? We don't even get to
Pero no
4%.
había, pero ahora sí apareció
So
dinero
there was no money before,
precisamente
but all
para
of a
cubrir
sudden, out of nowhere,
las
all this
necesidades de salud.
money was
Porque
allocated to address the
necesita
needs of the
reflexión,
pandemic.
simplemente.
So this calls for
Y
reflection, like I
también
said,
cuando
but
hablamos de la carta, ¿no?
when we
De
talk
una
about the
transformación digital,
charter
no hay
and
que
digital
trabajar
transformation is
con
also important.
todo lo que tiene que ver con
We need to
tecnología para que
take
nos acerque más a la
advantage
gente.
of the
Pero
technology available today so
con
that we can
observar un
come
cuidadito
closer to people.
que también
But
produce
let's be
inequidades,
careful because
desigualdades,
technology
y
also
tenemos que mirar
creates
y garantizar
inequalities.
que eso no se dé.
So we need to ensure that
Además de
that's
todos
not
los
the
problemas que
case
está
because
generando
in addition to all the
la
problems that
pandemia
we are seeing as
y
a
podemos
result of
decir
the
que es el hecho
pandemic,
del
we
efecto
don't need
negativo de
to
la tecnología, de la
um,
mala información,
have
de la vida sedentaria que estimula el
technology
consumo.
have an
Todo esto,
negative
estos son temas que
impact
debemos
through
de
fake
muy
news or more
atentamente ir
sedentary
tratando
lives or looking at the screens
de esta
longer. I
misma
mean, we can
manera,
talk about this for days,
algunas de las pinceladas que
but
realmente nosotros
this is
podemos dar
in very broad
de nuestro
brushstrokes what I
planeta y
can
nuestra
say
salud.
about our planet and our health.
Muchas gracias, doctor López,
Thank you so much,
por estas
Dr.
reflexiones
Lopez, for
muy
these
importantes.
reflections.
Voy ahora a
And
preguntarle
I am
a
now
Jesús
going
Felipe
to
también,
ask Jesus
nos cuenta
Felipe
que este es su
if
espacio, ¿no?
you
Es
can tell us what you're
la
doing
Sociedad
from the
Mexicana de Salud
Mexican
Pública,
Public Health
¿no? Desde su
Association
perspectiva. ¿Cómo está usted
and
trabajando
how
justamente para esta
you
mejor
are
salud del
working to
planeta y la
achieve
población?
this
Adelante.
better um,
Bueno, pues antes que nada,
health
muchas
for the planet.
gracias, Jerry, por la
Well, thank you so
invitación.
much.
Gracias a
Good
AAS.
afternoon. Thank you, Jerry, for the
Fue un
invitation, and
privilegio
thank you,
participar en este
PAHO.
panel que
It
espero
is
que
a
sea el primero de
privilege to
muchos
be
más de los que
part of this
podamos
panel, which hopefully
discutir
will
y
be the
dialogar al
first of
respecto.
very many
Yo
we
creo que
can talk about
aquí para
this.
mí es muy
I
importante
believe that
hablar el
for me,
concepto
it's
de
very
una salud.
important to talk about this concept
También
of One
hablar
Health.
de la importancia que tiene lo que sería o
We
lo
were
que yo
talking about also the
visualizaría como las
importance
áreas
of
humanistas de
the
cualquier país que tiene que ver
humanities
con salud,
areas
con
in the
educación,
countries that have to do
que
with health and
comparten un objetivo
education
común, que es el
that have a
desarrollo armónico de
common
las
objective, which
capacidades
is
de
the
un individuo.
harmonic development of
Y
any
como bien se
individual's
señalaba, yo
capabilities.
creo que
And like
es
it was said
necesario
before, I
recuperar los
believe it
principios
is
básicos
necessary
de
to go
salud
back to
pública
our basic
sobre el
public health
adecuado equilibrio
principles
que
on
debe
the
existir entre la
balance that
gente,
must
huésped y medio
exist
ambiente,
between
entender que el
people, host, and
concepto
environment, and
de
to
salud
understand that the
que se
concept
ha
of
visualizado desde hace
health
60,
that
70 años sigue
has
siendo algo
been managed
aspiracional
for the
y que
past
más
60
en
or
estos
70 years
tiempos
continues to
donde
be
existe
aspirational,
todo este crecimiento
especially in this
urbano
day and age where
y
we see
donde
this
hemos
big
avanzado
urban
en la mayoría
sprawl,
de los países de
and where in the
Latinoamérica
majority of the countries
por
in Latin
una
America,
transición
we have
demográfica, una
seen a
transición de riesgos, una transición
demographic
epidemiológica
transition,
y sobre todo lo que
epidemiological
espero mucho más
transition,
hoy
risk
para
transition,
los de manera
and
importante la
especially
transición tecnológica.
more so than ever the technological transition. Understand that over 10,000 years in mankind, the life expectancy was just 32 years old. And we need to look at life expectancy as an indicator for the degree of development of any given country's healthcare systems. Over the past 70 years, we were able to go from 50 to 75 in life expectancy. And we see some countries that have a life expectancy, especially developed countries that focus on allocating more resources to these two pillars, health and education, that can have a life expectancy of 90 to 95 years old. And we need to talk about population aging because it is coming. So that is going to have a higher burden for for chronic non-communicable diseases. And like we said, the pandemic showed the weaknesses that our healthcare systems have, but also how important investing in health is. And part of the inequalities have to do with how in the countries we can have a privileged public healthcare system for a few and a public healthcare system that is completely neglected and underfunded for the majority of the population that is poor or that lives that are marginalized. And I believe that here we must also talk about climate change and to get ready for urgencies and emergencies. A lot has been said about the pandemic in Mexico in 2009, but the mortality rate would have been much higher if 5 years prior we wouldn't have bought oxytamivir if that was not the case. For COVID, we were not ready, but since the whole world came together to work on that, the whole international community was able to make vaccines available, even though unevenly. So we need to take advantage of this crisis and the repositioning of our WHO authorities and PAHO, and to highlight how important it is to ensure equity in the countries. The pandemic showed that what happens in Africa continues to impact developed countries, whether we
Muchas
like it or
gracias,
not.
Jesús Felipe, y
Thank you
también
so much,
Dr.
Jesus Felipe,
López.
and
Queremos
thank you so
dedicar, me
much
parece
for
que es
addressing
que
the
nos
issue
junta
of
a
equity,
todos,
which
¿no?
seems to be
En la
like
mesa desde
the
diferentes
common thread
perspectivas. Muchas gracias.
everything we're talking
Ahora,
about.
doctor
Now,
Carlos
Dr.
Galvez,
Carlos
desde
Galvez,
su
from
trabajo, desde su
your
organización,
work and from
¿cómo
your
usted trabaja
organization,
para
how
mejor salud y
are you
en la red?
working to achieve better health in
Sí,
our planet?
gracias. Y gracias
Thank
por
you.
invitarnos a este
And thank you for
interesante
inviting us
panel
to this very
y
interesting
gracias a todos
panel.
los
And
compañeros
thank
del
you
área de
to
salud
all of
por
my colleagues
escuchar y
from the health
participar y por
area
las
for
preguntas que
listening,
nos
for
van a
participating,
hacer.
for and for the questions that you will
Si
be
nuestro
asking later on.
objetivo es una
If
sociedad
our
próspera
objective is to
en cada
have a
país,
prosperous
ciudades
society in
adaptables,
each
economías
country
resilientes al
with
clima,
livable cities
nosotros
and
pensamos en Panamá
climate
que
resilient cities,
supera
in Panama, we believe that
la
this
esfera
goes above and
climática
beyond
de
weather or
trabajo.
climate
Es una esfera
itself.
que hay que trabajar desde un nivel muy
We
superior, el
must
nivel
work at a
de
much
cambio
higher
profundo en los
level
gobiernos
and to introduce deep
y para lo
changes
cual
in our
nosotros
governments.
estamos
And for
enfocados
that, we
en,
have
por ejemplo, la
focused
construcción de un
on,
estado
for
de
example,
bienestar
building
en cada
this
país. En
welfare
Panamá,
state.
el estado de
In
bienestar,
Panama, this
eh,
welfare state
no estamos partiendo de cero,
is not
estamos
starting
partiendo
from
de una
scratch,
situación
but
de
rather
crisis que
from a
hace todavía más
situation of
complicado
very
lograr
severe
avanzar en
crises
ese
that
estado
made
de
it even
bienestar,
more
pero es nuestra meta
difficult to
y para eso
make progress in that sense. But that is our
sentimos que se
goal.
requiere
And for that, we believe
algunos aspectos
that
como por ejemplo
we
la
need some
redistribución de
aspects,
recursos
for example,
y el poder.
redistributing
En esos
resources and
cambios
power, because without
que son
those
cambios
changes,
muy grandes,
which
muy
are
difíciles,
very major
es
changes
muy
and
difícil,
difficult to
casi que
make,
imposible
it will be
lograr un
almost
estado de bienestar.
impossible to achieve this
No
state
podemos
of
seguir
well-being,
en
not
un
welfare,
país,
and
en dos
interpret
países
apologizes.
con una
In our
polarización
countries, we
tan
cannot continue
significativa de los
having
recursos,
this
donde hay muy pocos con grandes riquezas
unequal
y una
distribution of resources
gigantesca
where we have a
mayoría
very
con una
small minority
pobreza
that is
extrema
extremely
tridimensional.
wealthy and then the
Y el
vast
poder también.
majority
La
is
redistribución del poder
poor,
no puede estar
poor.
centrado en
And the
unos
same goes for
partidos
power.
políticos y
Political power
que
cannot be
la
distributed
población,
in
la
just one
comunidad
or
no
two
tenga
political
prácticamente ningún poder
parties
decisivo sobre eso.
with powerless
Y para eso
communities. with no decision-making power. So our communities should be able to choose leaders that have plans that truly meet society's expectations and to make them accountable for those results, maybe legally or even criminally, to abide by what their plans said. We shouldn't have to wait 5 years to once again hope for the next administration to promise something. And on this, there's also a very important aspect in our point of view, which are social values. We have the priority in building new social values. Our social values are putting a big break on building this state of well-being. We have this deep corruption, and we need to make a big effort to foster solidarity and responsibility. If we can combine all this, we will more likely than not be able to build livable cities, prosperous societies, and to have sustainable practices. Thank you. And I give the floor back to you. Thank you, Dr. Galvez. Very interesting reflection on the need to have these deep, major changes. This is not easy, but it is truly necessary so that we can have healthy societies. We're talking about social determinants for health. So thank you so much for that.
To switch to English. Como saben, ahí abajo está la
As you
interpretación.
know, on the bottom of the screen, you have the globe icon for interpretation. So you can click on that and select Spanish if you need that.
Same for you. From your area of work, what are you doing to ensure that we had a better planet and a better health for our communities? Go ahead.
Yes, thank you again so much for having me. It is such a pleasure to be here with this incredible panel. I will try my best not to repeat too much of what others have already said, although that'll be difficult. Lots of wonderful points have been made. But I would really like to focus, I'm I'm the Deputy Director of the Center for Climate Health and Equity at the American Public Health Association. We've heard a lot about climate health and equity so far today. I definitely want to focus on the urgency around these issues. That's something that we at APHA have been really trying to underscore in every communication around this topic. As Anofo mentioned something very interesting in that with the COVID-19 pandemic, countries poured all of this money into solving this crisis. They came through with these huge investments in solutions. And that is something that really is needed to help combat the climate crisis. Folks need to see this as an urgent, the crisis that it is. It's hurting people every day. We've mentioned, some of the health impacts already, from heat waves to air pollution to drought and wildfires, natural disasters, the mental trauma from living through this crisis, and for the anxiety that comes with youth in this world worried about their future. There are so many health impacts that are not distributed equitably. As Danielle mentioned earlier, those hurting the most from the climate crisis tend to be those that are least responsible for it. Low-income populations, communities of color, and then globally, sort of the global south tend to see the worst impacts from the climate crisis. Whereas, these wealthy nations, including especially the US, have been responsible for such an outsized share of the greenhouse gas emissions that have led us to this situation that we're in. And this is not a new message. For decades, governments have been warned about the impending crisis that we find ourselves in the middle of right now. And government and industry for years and years chose to do nothing about it, or very little in some cases. And now we're seeing the impacts of that. When we came together, the world came together around the Paris Climate Agreement 7 years ago, and they said, we're going to try to keep warming below 1.5 degrees Celsius, 2 degrees Celsius at the worst for average temperatures. And we've already seen reports come out very recently that we could see 1.5 in the next 5 years. We've got a 50-50 shot of hitting that. And these impacts that we're already experiencing globally will only get worse. So, as we think about that, as we think of who is bearing the burden of all of these health impacts and who really caused it, it takes not only lots of action within our countries, but in the case of those of us in wealthy nations, really pushing the United States and other countries to, pay for their share of this burden of, climate diplomacy and climate finance is such a big issue. In Copenhagen in 2009, the wealthiest nations agreed that they would dedicate $100 billion a year to climate adaptation and resilience globally. That was what they promised. It's not what's needed. Much more is actually needed. We've let this get out of control and it's become very expensive to deal with. But that's what was promised. And this year, the United States, the biggest contributor historically to this pollution, was able to give 1 billion in a bill that passed recently. And that is just not going to cut it. And, we're seeing increased investment within our country. But this really is a global issue as well. And those that have caused the problem really need to step up. So that's a lot of what our advocacy is focused on at APHA, is getting health professionals across the country to speak from their experience, what they've seen in their communities, some of the impacts they've been suffering with, and take that to their leaders federally, at the state level and locally, and really driving home, the urgency and the realness of this issue for real people all over the world.
Thank you.
Yeah.
Thank you, Catherine. Yes, no, this is so interesting. And we are going to have time to elaborate more on this. I think it's very interesting to hear all those different perspectives. And thank you very much. And talking about holding governments accountable, particularly those that are most guilty, to put it like that, for the contamination, etc. Thank you so much. Ahora paso nuevamente a español y voy a pedir al
Now,
doctor.
once again, I go back to Spanish and I am going to ask Dr. Arturo Quispe, who is the REAC Latin America director, to tell us from his organization and from his community, because he's working a great deal to build a better planet and a better health. Please go ahead. Thank you very much. Good afternoon. I would like to thank PAHO and also the Public Society of the Alliance of Public Health Associations of the Americas. I would like to thank the panel members who have shared their experiences so that we can better understand the problem. I really liked to listen to Daniel, in particular when he said that we need to listen to the most vulnerable. I think that all of the speakers point to that. They need to listen to those who suffered, the ones who became orphans, the ones who became victims, even though they were not directly responsible for the problem. And to that end, I was remembering that in 2013, we had the opportunity to promote a leaders meeting. And the question was, what type of world do our children expect us to leave behind? And I'm wondering what planet we're leaving behind for our children, our grandchildren, future generations, those who come after us. And that same year, when we had that meeting, we had the privilege of having the publication of a book by Matías Cepeda, an Argentinian kid, who wrote a book on the loud silence. And The strange aspect is that I had no clue how he could learn to write with his acute paralysis. And it was his mother who used a tablet and symbols to learn and taught him to understand, taught him to convey, and she learned to interpret the silence voice through the disability that the kid had through his vulnerability. And Matias Cepeda was telling us, I am just another piece of the whole, and we make up a world. And if I damage a piece of this whole, my world will not be the same. Therefore, I will not be the same. So if I would like to be happy, I need to strive for each part in my world to be happy. If each part of my world is happy, my world will be happy. This is a great lesson from a vulnerable voice. He was talking about the earth. He was telling us, and he continues to tell us, that this is about a live superorganism, a unique community that is indivisible, that has to be taken care of, that is self-regulated, that is populated with invisible and visible beings, and those invisible and visible beings are responsible. Now, when we call these times the times of the man, and this is a lesson that is very clear in our minds, and for 15 years now of actual life, and moved by the learning and the knowledge of ancestral peoples based on reciprocity, solidarity, and complementarity as principles, based on our own concept of the earth and the recognition that the microbian world is the reason of the ecological systems. We think that the response to antiretrovirals needs to come beyond the biomedic approach. We need to recognize that microbes, that bacteria are a key aspect of our lives. We need to be humble as human beings to recognize that as human beings we have responsibilities more than power for destruction. And within that realm, and also for the last 15 years, my organization has been working with children, teachers, schools, and social organizations, trade unions, because as we have heard, and also as we have seen during the pandemic, I need to take care of the person next to me. Otherwise, I will also be unhappy and I will suffer the impact. From that point of view, REA consider resistance to antiretrovirals and also resistance to to antibiotics, something that needs to be addressed if we are trying to have a healthy planet, a different planet, and health for the animals, the human beings, and the planet as a whole. We insist in our discussions and throughout our meetings that we are all responsible, and that we need to have a dialogue with the academic sector and also with the ancestral peoples, with children, with adults, and with the elderly. But once again, we confirm that we need to focus on defending and promoting life of the human beings, plants, and animals. Thank you, thank you, thank you very much. Your point of view is extremely interesting, and how you show us that we are part of the whole. And I think that it was very interesting to see the various point of view. We saw quite a complete and complex situation as to the weaknesses and the various, the relationship and the inequalities that we have. So now I am going to ask each of you, as part of this reality that we have, that we see, what are the priorities for action? What do we have to do to change this? And many of you have already addressed this, but please let us know what the weaknesses are and how we need the most significant ones, the ones that we need to address right away. And our colleagues can also send us questions through the Q&A or the chat buttons, because we will also have some time after this discussion. So we now continue. We follow the same order. Daniel
Las
from PAHO.
prioridades para la acción.
Gracias.
Please let us talk about priorities for action. Thank you.
Primera ronda, ¿no? Y Doctor Arturo.
We had an incredible first round, and Dr. Arturo really moved me with his story about Matías Cepeda. This kid, it's an incredible story. Now, if we're talking about the work I do from PAHO with the countries, the key issue we're focusing on is to build governance in the area of health and climate. PAHO, as an entity that is working with the ministries of health or the health systems beyond the management of the ministries of health itself. But this space has to do with building governance and also making sure that those governance structures that we build are part of the civil society, the governments, and also those who are marginalized, those whose voices are not heard. So we are trying not only to use, understand the priorities, for example, of the indigenous populations or traditional peoples, but also a new point of view, a new way, their way to see the world, which is not necessarily the same one we have in the national planning documents. So in connection with that governance structure for health in other sectors, we can start to build the planning systems and all of the documents that the countries are going to need, and also the commitment with the United Nations framework on climate change, as well as the climate funding mechanisms and funding for health. So the idea is to build comprehensive health systems with observatories, early warning systems to get ahead, to anticipate of the impact. We do not need to be at all times behind the problems to address them, but we need to take action to prevent and promote health, so that we can act before we have problems. This is key. And I think that as we put it together, at least as we are working on this, this is the way we look at this. That is to say, we are building the interministerial agreements in the area of health, and also investments to first understand the impact of climate change, and then to move the efficacy of the interventions that we are suggesting. So it is not easy to address this, but at the outset, this would be my reaction. Thank you very much. Thank you, Daniel. And this is just to frame this internationally and how we're working on this at the level of the region. And from the point of view of the countries, here we have our experts, the experts from the area of public health. We're going to start with Anulfo from the Dominican Republic, the action. What are our priorities for action for your country and from your own point of view? Microphone, please. I thank you. And this is not only as a country, but also as a partnership and as a region. We need to do everything that has to do with discussing, thinking, and organizing. What is it that we have? What is it that we are discussing? What are we discussing about the sustainable development goals? What are we going to do with the review of the essential public health functions as a result of the pandemic, which were currently developed in 2021? So we need to offer an answer. How can we do it? We just faced the COVID-19 pandemic, but are we really thinking as to how to use this as experience to be better prepared for the next one? So what is the priority? We need to get organized. We need to sit down at a technical roundtable with all of the national, international organizations, whoever wants to participate, but mainly we need to have a human approach, because these are individuals who are making decisions for other individuals. So I shouldn't even care about their economic level, ethnic group, race, beliefs, or preferences. First, we need to sit down and learn from the mistakes, where we could also see that developed countries had a significant crisis during the pandemic, and even countries such as ours had rewarding experiences in the management of the pandemic within our means. But what is next? What is next? That is the question. So first we need to organize, to sit down and identify what the priorities are, what the weaknesses were, what weaknesses we are currently facing, and what we are going to do next. So we are going to establish an order. So based on that order and with all of the sectors, once we have already seen that the social determinants of health are very specific in connection with people's health. So in order to have healthy populations, but this cannot address all of the problems. So we need to work with other sectors. We need to work with everyone. So we need to clearly establish the policies, the health policies in a cross-cutting fashion, so that there is no state or department that doesn't give priority to health, because we have seen this during the pandemic. Nothing matters without health. The whole world came to stop. Nobody thought that this would be possible. So when the animals were the one walking the streets and we were locked up at home. So what are we going to do? As part of the priorities, I understand that we need to sit down and work in partnerships. And this type of dialogue is very useful. But we need to do this at the local level, at the level of the countries, with the various sectors, with the various sections of the community, because then we realize that when we have the terrible storms in the Dominican Republic, you can imagine what happens with the most vulnerable individuals, the usual ones. So this is what we should do, in my opinion, to determine the north, the direction we need to follow from each of our countries in the region, and also based on our current situation. Thank you. Thank you very much, Dr. Lopez. The north, to go after that north. This is extremely interesting. Mr. Felipe, what is the north for Mexico? I like to be thought-provoking, and I think that this is what leads to changes. Daniel was talking about good governance, and good governance in connection with national health systems and also comprehensive systems. But the truth is that we have not been consistent. We have not done what we said we were going to do. And from that point of view, I think that we need to start right there. We do not have clear, concrete goals, common measurable indicators. In general, most of our countries leave behind what governments or administrations did whenever the administration changes, to try to reinvent the wheel. And as a result, we cannot move forward. If you analyze, for example, from the point of view of diseases, I was at one point the director who during 6 years was able to certify the elimination of 3 diseases in Mexico: human rabies, onchocercosis. And it was not because of the work we did during those 6 years, but because we recovered what had been done before, and we also included more resources to have more concrete measures as to what to eliminate. And I do not think that we have a regional policy. Adolfo was referring to meetings, and I can tell you that PAHO has an incredible number of meetings for all of the topics. And for example, in the area of vectors, there is one group working on malaria and another one on dengue. They both meet at the same time, and in the countries they're all the same. So you need to see whether the countries are going to go to one meeting or to the other. For example, I was working on dengue for 5 consecutive years when we were told that it was a cyclical syndrome. And now with dengue, we see this clear climate change and this adaptation. In our books, we used to read 10 years ago
Y entonces
some
necesitamos
viruses that
aplicación.
used to exist at 10,000 feet and now they are at 2,000. So we need to have rational use of insecticides and also prevention of diseases. I think that social determinants of health are good. I am not going to talk about that because we can talk about that a great deal, but it is true that this is the priority is health, and we need, in the area of public health, we need to train, we need to educate, we need to inform. I am not going to go into details, but when we look at what is devoted to prevention in the countries, this is much less than what is devoted to curing the diseases. So we need to focus on the first level of care. We need to focus on the first level of care. And also when we're talking about budgets in our countries, 90% of the resources are devoted to second and third level and only less than 10% to the first level of care. And that's where we see 95% of the illnesses, and we are not able to prevent them. And third, we need to see clear regulatory policy as another pillar. And this regulatory policy should focus on input and also good manufacturing practices, good quality medicine, with safety and security, and as to vaccines, clearly the same policy. And fourth, we need to have a tax policy that the need to invest in health. So I think that the governments have realized that health cannot be eliminated, in particular after the pandemic, when everyone started to see the importance of health. We need to take advantage of this crossroads so that we have better resources, better trained resources, better human resources, and less urbanization in the area of health. In most of our countries, the authorities have their friends work with them. And for example, in the health area, we have the friend of the politician who won the election who is working in the health area instead of the expert who could be working on prevention. Thank you very much, Jesus Felipe, for your thought-provoking comments. I think that one day we are going to have a very comprehensive idea of what we need to do within this framework. And now, Mr. Galvez, Dr. Galvez, action, urgent action. What is it that we need to do? Thank you. I like the word urgent. The main priorities are many. We have many needs, but one is how we can curb the climate crisis that surpasses any other topic. We could even think of the pandemic crisis as something relatively small, given the impact it may have. And this also risks the survival of the human species. We're also referring to the fauna and the flora on the planet. So this is something of COVID-19 pandemic left us many side effects and pain and deaths, but the upcoming climate change, climate crisis is real. And the changes and the speed of change imply that in the next 36 months, whatever we do to stop that climate change will determine whether we are getting to a no return point where it is irreversible, the damage we will inflict on the planet, so that this will have an impact on the human lives, the availability of food, and also the social life, everything that we have built and whatever we're leaving behind for our children. How are we going to do it? We need a new development model. It is impossible otherwise to say, just to talk about the impact of the climate crisis. The neoliberal development model that has been typical of most countries needs to change. It has to change because it is the one that has contributed most to the creation of the CO2 and also greenhouse gases. This has led to the warming of the planet and led to contamination. So this model is key and urgent. We're already able to have access to building a development.
Necesitamos también un nuevo modelo de pacto social en nuestros países. Las constituciones están diseñadas para justamente tal vez darle oportunidades al que tiene recursos económicos, supuestamente para que haya.
So we need
Pero lo que ha habido es realmente un gran.
We need a new social compact. We have had growth, but without development. A lot of people became richer, but a lot more became poorer. And I believe that if climate change and the climate crisis prospers and continues to sprawl out of control, nothing that we do will be relevant. This looks like out of a science fiction movie, but it is a very true, a very real, and very big risk. So we must do something now, right away. Thank you so much, Carlos, for that urgent call to greater action and calling for a new development model. These are very important reflections, by the way.
Switch again to English and to ask Catherine also about what urgent action is needed.
Thank you. Absolutely. So this may be an oversimplification just a little bit, but at this point, the urgent action that is needed is, I mean, there is no one solution, 3 solutions that I can point to. We need to work urgently across sectors. We need to push forward solutions in transportation and energy and the health sector, you know, all across the economy, all across the world. You know, as Carlos just mentioned, this is about survival. And we've waited far too long to act ambitiously to curb the worst impacts of the climate crisis. So, you know, a lot of the most important pieces of action fall into, you know, reducing greenhouse gas emissions across the economy, fall into, you know, investing and researching and adaptation and helping those that most need it be able to respond to the climate crisis, be able to protect themselves, be able to protect their health in the midst of this crisis, which, you know, is just creating, you know, like Jesus Felipe said, I like that he said we need to train, educate, and inform. But I would actually add on to that as well. We need to train, educate, inform, and mobilize. We need to get people involved in pushing for these solutions that impact their lives, especially those who bear the greatest burdens of the health impacts of climate change. They need to be meaningfully involved in this action, in pushing solutions forward, not just because they are the most impacted and they need to be able to see the benefits, but also because some of the most equitable and best ideas will come from those communities. And we need them just as much as they need governments to pay attention, and as much as they need to build power around this movement. So luckily, there are so many people across the world working on this right now, from experts like those in this room to governments to even young people who are raising their voices globally for more ambitious climate solutions. But mobilization around all these different actions and all of these different solutions is needed right now very urgently.
Thank you so much, Catherine. Thank you. So, entonces, doctor Arturo, ¿usted qué dice que es
Okay,
necesario?
so Dr. Arturo, in your opinion, what do we need? Okay, from our perspective, if we take into account that antibiotic resistance cause over 1 million deaths and is a leading cause of, or was the leading cause of death in 2019, according to Lancet. And if we take into account that millions of human beings lose their lives due to the lack of effective antibiotics, and out of those millions that die on a yearly basis, 700,000 are children that die of pneumonia, which is a completely preventable disease or treatable at least. If we take into account that obstetric infections are the third leading cause for maternal deaths in our countries and in Africa, in sub-Saharan Africa. And if we take into account everything that has been mentioned this afternoon, especially in terms of global warming and the impact that COVID has had over the past 2 years, I believe that it is key to work to pressure for a treaty on pandemics that must include antibiotic resistance with a One Health approach. That is pressing. It is something that we must do now because we're talking about 1.27 million that could have been saved. We're talking about millions of families that are suffering as a result of this. And we're talking about an issue that goes above and beyond just a medical issue, but rather an environmental issue that seriously impacts the sustainable development goals for the 2030 agenda. And also, finally, we must rethink very strongly the need for changing our agricultural feeding model. The hypotheses that were developed around how COVID-19 started are closely linked to the agricultural feeding model that we have, especially from our point of view, where 80% of the antibiotics that are made are overused in the intensive breeding of different animals for human consumption. So this is something that we must reflect upon. What are we doing? What are we producing? How are we producing that? And how are we eating? 60 to 70% of the global population ha has malnutrition or obesity for that matter. And that comes with heart disease, hypertension, and metabolic diseases. So we're talking about a whole host of um, so-called modern diseases. So we need to find the root causes and we must address those root causes and address the way in which they're being produced, they're being distributed, and they are being consumed. Thank you so
Muchas
much.
gracias, doctor Arturo.
Thank you so
Muy
much,
interesante todo
Dr.
lo que
Arturo.
estamos escuchando
Everything we're hearing here is
desde
very interesting
el tema de gobernanza
from
global,
the point
sobre
of
las
view of
necesidades de
global
cambios profundos en
governance, the
paradigmas,
need for
sobre
deep
el tema de
changes
poner
or
el
changes
dinero
in
donde es
paradigm,
necesario,
put resources
sobre
where they're
no ser
needed,
suficiente tener
and
políticas y planes, pero
to
también
have
implementarlos
policies and plans, but
y
implement them
empezar a
as well,
conversar con las personas, no tanto en los gobiernos,
to listen
no en
to
los
and
entes
work with
sectoriales,
people,
pero
not only at the
también con las
government
comunidades,
level,
¿no?
but also,
Nos
and
quedan
most
unos
important,
25
more importantly,
minutos,
with the
tenemos algunas
community.
preguntas ya
We
en el
have
chat,
about
pero yo
25
quisiera
minutes
ver,
left.
hay
We
una
have some
pregunta
questions on the chat
que
already,
es parecido
but
a lo
there's a
que íbamos a
question here that
discutir,
is
¿no?
similar
Sobre
to what we were going to discuss,
cómo
and it
podemos
has to
empoderar
do with how
mejor
can
a
we
la gente afectada, ¿no?
empower
Porque todos
the
hemos hablado de
impacted
esto
people and give a
y todos
voice
sabemos
to
que
them.
necesitamos cambios
Because we have all
de muy
talked about
alto
this, we all
nivel
know that we
lingüístico,
need
más
very
allá
high
de
level
nosotros,
changes
más allá del sector
that
salud.
go beyond our
Pero
sector, the
¿cómo
health
también
sector.
podemos
But So how can we work with our communities, with the people? And each one of you have said that have suffered and are suffering disproportionately from the result of this crisis, the pandemic, the climate crisis. And like we said at the beginning, it is always the same group of people that suffer the most. So what can we do? Not only make decisions for them, but also with them, so we can work with their perspective in mind. So let's be brief so that we can have time for other questions as well. And to the colleagues that are listening, if you have any questions, please post them on the chat. So in 1 minute, how can we work better with our communities, like we said, with the most vulnerable ones in our communities?
Gracias, Jerry,
Daniel.
por la pregunta.
Thank you so much,
Y
Jerry, for the question.
pensando un poco también en cómo
Now,
poner en esta
thinking
ecuación,
about
¿no? De
how
trabajar con los
to
vulnerables o
work with the
excluidos,
marginalized, with the most
comenzar
vulnerable ones,
la
but also
prioridad,
how
¿no?
to give
O salir
priority
en la
to
ecuación
health,
y la
how
toma
to
de
include
decisiones en todos los
health
niveles,
in
¿no?
the decision-making
Y
equation at all
nosotros ahora
levels.
tenemos un abordaje acá en la OPS de
We here
desarrollo de
at
herramientas
PAHO
que están
have
diseñadas
developed tools
específicamente para
that were
ciudades, no para
specifically
comunidades,
built for
porque
cities or
también tenemos
communities
esa
rather,
intención de no solo
because
trabajar
our
con las
intention
naciones
is
a nivel
to
nacional
not only
o a
work
nivel
with ministries at the
multipaís, pero
national
también
level
llegar
or
a niveles más
multi-country level, but also
locales.
get
Entonces,
to the
trabajando
more
con
local level.
¿no? los compactos de
So
alcaldes,
working with
con
mayor
redes de
compacts
sociedad
and
civil.
civil
Tenemos, por ejemplo,
society
herramientas para
networks.
evaluar los
We have tools,
impactos
for
de
example, to
transporte activo
assess the impact
o
of active
áreas verdes
transportation
urbanas
or
o
green
de
urban areas
sistemas alimentarios con
or
producción local.
food
Y
systems with
para
local
su
production.
incorporación de los más vulnerables,
And
quisiera
in
comentar
order
también
to
tenemos
include the most
un
vulnerable ones of the
abordaje de
population,
diálogos
we
interculturales,
also
que es
have
justo para poder
intercultural
incorporar la
discussions. That
visión,
way
la
we can
perspectiva, no
incorporate
solo las
the point of
opiniones de
view,
los
the
planes
perspective, not
existentes,
only
sino
their
las
opinions on
visiones
existing
antes de la
plans, but
preparación de los
also
planes
their
para que
vision
los
before
planes
the
puedan
plans
ser
are even developed,
diseñados
so
por
that the
estas
plans
comunidades
can be
y tomando
developed
en
by the
consideración
communities
algunos de los
themselves,
aspectos
taking into
importantes,
account
cómo
some of the
poner
concepts
salud
that I mentioned. So that is to say,
en
how
el
to put
centro de la
health
discusión,
at the
tanto
core
como
of
entendiendo
our
como siendo
discussion,
un bien fundamental
understanding
para el desarrollo,
health as a
porque si
fundamental
no hay salud, si las
good
poblaciones
for
están saludables,
development,
no hay
because if the
cómo
population is not healthy,
tener
there is
economía,
no
no hay
way
cómo tener turismo, no hay cómo
we
tener
can
producción,
have an
pero
economy or
también
tourism
como
or production for that
resultado
matter,
de las
but
políticas.
also
Entonces, a
how
los
it
dos
can be
brazos
an
queremos poner
outcome
salud en el
or
corazón
output
de estas
of our
discusiones
policy.
y
So
hacerlo lo
basically, we want
más
to put
local
health at the
posible,
core of these
escuchando sobre
discussions
todo los
and
que
make it
son
as
afectados
local
por
as
los
possible and
impactos
listening
y
to the
bien
ones that are
fuerte.
impacted the
Quizá
most.
hacíamos
And to do the
propósito,
same
¿no?
thing
De
that we
los
were doing
grandes
before, that is
planes
to say, to
multipaís o
have
planes
these
nacionales,
big,
pero reflejados a
national or
niveles subnacionales de provincias,
multi-country levels,
de
but with
municipalidades
the
y
local
de
color
comunidades.
to reflect the
Eso es
realities of the
súper,
communities.
súper
So this is
desafíos,
a
pero lo
huge,
que
huge
hoy estamos
challenge,
trabajando más
but
y más es de llegar
we are
más
working
cerca
more and
posible los
more on
niveles locales
trying
de
to
acción.
get to the local level of action.
Muchas gracias, Daniel,
Thank you
por
so
esta
much,
reflexión.
Danielle, for your
Am,
reflections.
a ver, Anulfo.
Sí,
Arnulfo, go ahead.
gracias, gracias, Ari. De verdad que
Thank you.
muy atinada la reflexión de Daniel.
Daniel's
En el caso
reflections were
nuestro
very
tenemos
on point.
alrededor de
Now,
3 décadas
in our
haciendo
case,
unos
we have been leading our
trabajos
foundation
precisamente en las
uh,
comunidades.
for about
Son
3 decades,
aquellas
and this
comunidades que
foundation
necesitan de los
works
servicios
directly with
básicos
the
de vida.
communities with the people that
Y,
need the
y
services.
eso es parte de lo que debemos hacer.
And that is
Es que
part of what
nosotros,
we need to
desde
do.
cualquier lugar donde estemos, tenemos
So
que tratar
regardless of
de
where we
estimular
are, we need to
que
try
la
to
gente
stimulate
conozca todo
this
lo
so that
relacionado
people can
o
be
todo lo que
familiar
puede
with everything
afectarle de manera
that
directa o
could
indirecta.
impact them
Y que
directly
vivan
or
siendo las cosas
indirectly.
de ellos que realmente
And
nosotros debemos hacerle partícipe de las
we
decisiones y
must
darle a
include
conocer los
them
derechos que
in
tienen
the
como,
decision and
como
let
seres
them
humanos.
know
E inclusive en nuestros
the
países,
rights
que
they
son la
have as
mayoría de las
human
leyes
beings.
o los códigos
The majority of the
de salud
countries
o las leyes generales que
and
tenemos reconocen el derecho que
health
tienen
services
la persona,
acknowledge
los
the rights of the
afectados a la
people,
salud. Pero también podemos aprovechar esta coyuntura de la
but
pandemia
we must
donde no todo
make
el
the
mundo
best
se vio
of the
afectado.
pandemic where everything was impacted to make people understand how important it is to be part of the health decisions made at the community level. And so we need to get to the clubs, to the churches, to the schools, and use the schools as the basis, the starting point. And the same happens with primary healthcare units because primary healthcare is key. If we were to do what we did in back in 1978 with primary healthcare, the response would have been completely different. So I believe that it is through that primary healthcare and community empowerment by letting them know their responsibilities each one of the people have that are part of a household, and households or families are uh, the core cell of our communities. So we need to try to do this work at the local level. I believe that we're working at the global level, but we need to focus at the local level, on the local level, because those are the beneficiaries of everything that we do. Thank you, Arnulfo. On the chat, I see a question that says, okay, we know a lot of things. We have multidimensional poverty indices, we have indicators. So if this information is made available to everyone and we reflect among professionals and the academia and the community, Jesus Felipe, how can we make progress in this way? What gains can we make? Like Daniel said, the key is to work and to have communities work on identifying what their priorities are. And we must understand that a lot of their communities need food. That's the most basic thing. A lot of our people live in extreme poverty. In Mexico, we have over 40 million people living in extreme poverty that cannot meet basic nutrition, housing, education, and clothing needs. So we need to do more at the community level. We need to do more field work. Second, the violence that we see in a lot of our countries also creates insecurity and premature death, and especially social fragmentation with the migration phenomena that we have and that impact our society. So basically, we need to also strengthen our community, especially communities that are rich in, for example, vegetation or shorelines. We have not done a very good job with that. And I believe that in this, it is also very important to think about how we train our political leaders, because a lot of the political leaders that we choose are not necessarily the ones that know the most about this. So we need to train them so that they can truly see the need that they have to have healthier population, because healthier populations are more productive and also create more well-being for society as a whole. So I would suggest a strategic change. So for now, national healthcare centers or systems focus on treating diseases. So but we need to address healthy population with more out of hospital than in hospital care, and especially using the very important social mesh that our communities have. Thank you so much, Jesus Felipe, to talk about the assets that our community has and how important it is to keep our communities healthy and not just invest in treating diseases or sick
Sí,
people.
gracias.
Carlos, go ahead. Thank you.
Darle participación a la comunidad
So
y fortalecer
also
esa participación
to
es algo
engage
extraordinariamente vital.
community and to let them
¿Cómo hacerlo?
participate is key.
Desde
But
nuestra
how do we do it?
perspectiva,
Well, from our
lo
point of view,
principal es
the most
la
important
información
thing
que se le da
is the
a la
information
comunidad.
that we give our
Partiendo de
communities.
allí, la información correcta, oportuna,
So first of all, it has to be
masiva, a
accurate
través de todos los
information,
medios
timely,
posibles. ¿Qué
mass,
información?
through every possible media and also what information we are sharing. This goes back to what Alcides was saying: personal, family, community, and national rights and duties. People must understand that so they can also understand the right they have to express themselves. Now, where are they going to express themselves, or how are they going to do it? Well, we need community organizations to work at several levels, not only with different social clubs or sports clubs or religious churches, but rather we need to work at the micro level to have, for example, health communities at the street level or at the neighborhood level, and to work our way up from there. And I wouldn't call them health committee because this it can be understand that it can be understood as having a committee that focuses on disease. I would call it comprehensive well-being committees that are in charge not only of healthcare issues, but also all of the aspects that have to do with social determinants for health. They may not understand the concept as such for now, but they would be addressing all of these needs and think about how to face this.
Esa comunidad ya organizada debe tener
And also, this organized community must have real power. That is to say, to access, for example, political decision making fora or community uh, halls or county halls or whatever. But that doesn't mean to have a chair at the end of the room and raise their hand to see if someone would give them the floor, but rather to have a vote to be able to decide on the priorities that impact the development of their communities. And in order to do this, we need to change
de salud.
our health, our approach to health. And even to this day, the majority of the population and of our authorities think that talking about health means talking about the medical aspect of it. So we need to talk about comprehensive well-being so that people understand that when in the past we were talking about health or being healthy, we were talking about every single factor that has to do with having a healthy life. So, giving a voice to the people, but also for people to understand that they must participate and become engaged through some kind of grassroots organization so that they can voice their needs, voice their concerns, as well as their opinions about what the best solutions might be. This means, for example, to have the right to organize activities so that there could be an, an opportunity to discuss a community issue, and the community itself can suggest the most appropriate solution rather than coming up with solutions that are imposed by the different government
Muchas gracias, Rocío,
authorities.
por hacer
Thank you.
énfasis, ¿no? Que
Thank
las
you, Carlos,
soluciones
and thank you
vienen
for
desde abajo
highlighting
por las
that the solution
comunidades.
comes from the bottom up,
Nosotros tuvimos
from the
ahora
communities
una
themselves.
reunión donde
And we just recently
acabamos de
had
terminar,
a
donde
meeting
justamente
that just
vimos,
finished,
¿no?
by the
Que
way,
muchas de las
where we
medidas de
saw
salud
that a
pública
lot of the
fueron
public
muy
health
difícil, ¿no? En el
measures
control de la pandemia
were
fueron muy
very
difícil de
hard
adoptar por la
to
población
adopt,
y nunca
to be
consultamos a la
adopted by the
población
population.
cómo
And we
podíamos
never
hacerlo
asked the
mejor, ¿no? Ahora
population how
estamos
we could
viendo
do our job
hay
better.
respuestas muy
So
interesantes
now
y yo creo que
we're
eso
seeing
también es
some
cosa que
very
ustedes nos
interesting
están
surveys
diciendo.
that
Yo
are
quiero hacer
revealing
ahora
some of
un
the stuff
cambio de
that you're
orden hoy.
mentioning.
Primero
I
voy
would
a
like to
preguntar a
switch the order
Arturo
a little bit. I
López.
would like to go to
También
Arturo
hay una
first and
pregunta en
then
específico
Catherine, because there's a
también
specific
sobre el tema
question also
del
on
costo,
the
¿no?
topic
De cambio
of
climático, cuánto
cost, the
tendría
cost of climate
que un
change, and
país,
how much a
su
given
país
country should invest
para contrarrestarlo.
to
Entonces,
limit the
Arturo,
impact of
adelante.
climate change. So, Arturo, go ahead.
Comunidad.
I would like to reiterate that as part of the lessons learned from the pandemic, we have seen examples of how an organized community truly became the core of our healthcare systems. So if the community decides to stay out of it, it stays out of it. and that's it. And we cannot impose anything otherwise. In the Czech Republic, for example, a group of retired people took the initiative to, in their neighborhoods or households, start making masks. And those masks were distributed in less than a week, and everybody had access to face masks. But in other countries from the same region or a different region like Brazil or the United States, people simply did not listen to the decisions that were made because they were simply because they were coming from above. So a lot of communities in Latin America started working on survival mode. So organizations and communities started encouraging um, agroecology to grow vegetables for their own use and also to share with neighbors, or exchanging seeds. These autochthonous seed banks where people go and exchange seeds. That's an expression of solidarity and also of knowledge and wisdom. So from our point of view, on the one hand, we believe that it is important to have the population be more informed, more educated on health matters so they can make a difference, or tell the difference rather between the fake news and real news. But we also think that it's important to expose the wisdom that lies in the communities. All of those experiences that get passed down through anecdotes or stories or their cultural history, a lot of those unwritten stories that show that they are an expression of knowledge and wisdom that have enabled populations to uh, live through adversity. So to promote this community wisdom, these smart communities that go back to ancestral knowledge, that take care of nature, and that have that sense of belonging to nature.
básico en el enfoque de una sola salud. Si
That
nosotros
is
queremos
a key aspect of this One Health approach. If we want to take care of the health of our community or neighborhood or county or state or country or planet, we must do that. During the pandemic, and this old lady was photographed wearing a face mask that was carrying a dog in her back who was always wearing a mask. And a meme said, if Mother Nature dies, where am I going to find comfort? So that is the wisdom that if our Mother Earth gets sick, so do plants, so do animals, and so do human beings. So that concept and that wisdom and that power that is made invisible sometimes must be retrieved and recovered, to go to the communities with the idea that we're going to learn from them and to listen to them, not to impose policies, but rather taking a look at the cultural context, because that's the only way that we can know what their aspirations and needs are. And through the knowledge and wisdom of their own traditions. And that's how we can promote the organization, mobilization, and engagement that result in decision making, not just going and abiding, but what has been decided at higher levels. Thank you so much, Arturo. This is very important. That engagement has to do with being given a voice and truly be part of the decision-making progress as not as a passive listener, but as an actor.
One has to do with something you mentioned in the beginning, bringing us back on the money. Are we really putting enough resources, to counteract on what's happening on climate change, and then also bring it back to the need to link that to communities. Go ahead, please.
Okay, great. I can take each of those pretty quickly. So absolutely not on are we investing enough. That's why we're in a situation now that is so dire and so frightening. There are data out there. People argue sometimes about what should be included. And, there's a lot of conversations about what should be included in the total cost of climate change, the cost of carbon. But it's been suggested generally that it would take, at this point, with how deep into this crisis we are, it would take a global investment of around $1 trillion a year to prevent further and more intensified catastrophe. And that is obviously a huge number. I said earlier that the world's wealthiest nations came together in 2009 and promised a $1 billion a year investment by 2020, which is not quite $1 trillion, but is still a very large investment. But we're not reaching that. Countries are not contributing their fair share to global investments in combating climate change. So yeah, there is data out there. There's some arguments around it, but general consensus is no. We are not pulling our weight, especially those of us like the United States that are the largest contributor to climate emissions. And then quickly on this issue of community engagement in climate solutions, been really appreciating with what the other panelists have had to say, and would just like to really put a fine point on, governments. I mean, at least in the United States, the federal government, state governments, local governments have been focusing a lot more on frontline communities and getting community voices into the process than I think we have at any other time in our history. And it's our job to really hold them accountable to the promises they're making, to making sure that they are meaningfully engaging community voices, that they're making those avenues for engagement accessible, that community meetings are held after work and there are childcare options available so that folks that do want to weigh in can. And then also when it comes to engaging with community groups and frontline communities, environmental justice communities, making sure they have the resources that are necessary to even engage on this issue, not just the information around climate change and health, but also they are battling so many other things at the same time. They are fighting for so many other unmet needs. It's not just climate change, it's also, industrial pollution. It's also, education and health issues, totally unrelated. And they need to, they are fighting so much at once. These frontline communities are usually bearing the burdens of so many inequities in our intersecting systems in this world, and they need more resources and more support from us, from anyone possible, to be able to engage meaningfully in these processes, because we can't just come in and be like, okay, tell us how to fix climate change issues in your community, right? We need to give them what they need to be able to do that, so that they can lead us on this issue and have the resources necessary.
Thank you very much, Catherine. Colegas, estamos ya en los últimos minutos de este panel.
We are reaching the end of this panel. We have talked about all the crises. We have talked about the climate change, inequalities that we have in this region, and also the antimicrobial resistance, COVID, economic, social crisis. Now, these are complex times, but I would like to give you all the opportunity in 30 seconds, very briefly, to share your hopeful message now at times of great crisis. Danielle, very briefly. Thank you, Jerry. And I really thank you for participating in such an interesting panel. And it is good to end up with a hopeful message. I think that so many complexities may lead to anxiety, paralysis, stagnation, but that is not what we want. We'd like for the spaces that exist, we listen to this, and this also leads to this eco-anxiety, that is to say, this climate problem that is risking the future of the planet. We need to see how these problems are already included in our daily lives and how we can strive a dialogue with other individuals more than what we did before. So we'd like to continue to talk to everyone and also finding solutions, shared solutions,
los excluidos, los vulnerables.
and also including those that were excluded, the vulnerable ones. Those are the most important voices in this process, the ones that are not heard. So if we continue with this mindset, if we continue to talk to the media, we continue providing information, good quality information, evidence-based information, but also taking all of the visions, all of the points of view. This is an important way to move forward. Thank you very much. Thank you, Daniel Anolfo. Hope, yes, the hope is that we can continue or we can start implementing actions that would allow us to avoid the catastrophe we have ahead of us if we continue in this fashion. So it is important to convey the message that change is possible, that we can change the greenhouse effect. And if we think that 3% of the plagues or large cities are only 3% of our planet, but they represent 60 to 80% of consumption, and they only produce 75% of the carbon emissions. So more than 90% lived with rates above what is acceptable in terms of air contamination, air pollution, and this caused the death of millions of people. So if we think globally, we need to make personal decisions, and so that we get to see what our carbon footprint is and what is it that we do. For example, if we connect a computer, a TV, or a cell phone, because all of the activities that we carry out create emissions, but water and the amount of water that we use whenever we shave or brush our teeth, the type of food that we use, and also the various alternatives, and we can make a difference. Thank you very much for this message, and I apologize. We are going to lose our interpreters. Jesus Felipe, hope. In 30 seconds. First, my commitment with Jerry and with Danielle that the annual meeting of the Public Health Mexican Conference may issue a statement on behalf of all of the countries of the Americas, and also so that in the upcoming year we can be the headquarters, we can be the host of that meeting and meet with all of the presidents. Even though I will no longer be the president, I have already talked to my vice president, and we are in the best situation to work together with you. And the challenge to create this Declaration of the Americas and start working right now. Excellent. Thank you. Jesus Felipe, Carlos. Thank you. We need to change the mindset. We can do it. We can do it. There is no time to waste. We are taking the future of our kids and the future of the planet in our hands, and people are acting as if they had all the time in the world to solve this and all of the solutions at hand, but that is not the case. How can we do it? We need to make a decision and act now as to the type of world we will be living. Please, come on, join the fight, and we will fight up to the end. Thank you. Thank you, Carlos. Catherine, what is your hope?
Yes, I'm so glad we're ending on this. I'd like to echo what a lot of my fellow panelists have said, and also just add that I find a lot of hope in seeing the youth activists on climate change all across the globe. It is really inspiring to see young people get so energized and work so hard to advocate around climate solutions. I mean, it's a shame that young people feel that they have to fight for their future in this way, but it is really heartening to see their energy and enthusiasm around this issue, and how much they're willing to dedicate to finding solutions and building power in this movement.
Thank you. Thank you so much, Catherine, for putting us back to our youth and our future. Y Arturo, su mensaje de esperanza.
Arturo, your message, your hopeful message to conclude this panel.
Hay que encarnar la esperanza definitivamente.
So we need to be we need to represent that hope. We need to understand the example that we get from our children, from the elderly, such as Matias Cepeda, who is talking about vulnerable populations. I think that we need to assert life, recognizing that life is diversity and health. And we also need to recognize that the resistance of our peoples is an expression of the fight for survival, and that life is just, there is only one life. And as we only have one planet and one health. Thank you. Thank you very much. I thank you, Arturo, for this closing remarks. Thank you all. I think that it was a very diverse, highly interesting panel. And we have characterized all of our challenges. And we have some commitments, how to see how we are going to continue working together towards this future. We need a fairer future, more equitable future, taking advantage of these opportunities. Crises lead to opportunities, and to take advantage of this, to work together for a better society, for a healthier world. Thank you all. I thank AASPA, APHA,
all of this. Y ojalá podemos contar con ustedes en
and
momentos
we hope to have you in the future to continue to discuss, but not only to discuss, but also to act together. Thank you all. Be well. See you soon. Thank you. See you soon. Thank you. Thank you.